Welcome to this module covering methods around enhanced surveillance and outbreak investigations for emerging respiratory pathogens, with a particular focus on the novel coronavirus COVID-19. By the end of this unit, you will be able to describe what we mean by conducting enhanced surveillance to find cases and how to conduct outbreak investigations in different settings. After a case of an emerging respiratory virus such as COVID-19 has been confirmed, there are several actions that need to happen at the same time to find additional cases to prevent further human-to-human spread. This includes actively finding laboratory-confirmed cases, thorough case and contact investigations, and some of this will be conducted through outbreak investigations, and conducting enhanced surveillance. What do we mean by active case finding? Active case finding involves a wider search for cases, which could focus on looking at patients and visitors in healthcare facilities where a confirmed case sought treatment. It can include healthcare providers who have cared for or who have cleaned the room of an infected patient, and it includes social, familial, and work contacts of the confirmed case. Once a laboratory confirmed case is identified, it's important to identify all of the contacts, all of the people who were in close contact of that confirmed case. WHO describes a contact who is a person who has experienced any one of the following exposures during the 2 days before up to 14 days after the onset of symptoms of a probable or confirmed case. Number 1, face-to-face contact with a probable or confirmed case within 1 meter and for more than 15 minutes. Second, direct physical contact with a probable or confirmed case. Number 3, direct care for a patient with probable or confirmed COVID-19 disease without using proper personal protective equipment or other situations that may be indicated by a local risk assessment. And on this slide is a link to WHO's Global Surveillance Guidance for COVID-19 virus. Contact tracing involves the identification and the medical follow-up of individuals who had contact with a confirmed COVID-19 patient. After you identify these contacts, it's important that you record certain information so that you can follow them over the 14 days after they had contact with that confirmed patient. What you need to record are their names, contact information, either a phone number or a way to contact them, and demographic information, their age, their gender, or any underlying conditions. It's important also to note the date of the first and the last exposure to that confirmed patient and the date of onset when fever or respiratory symptoms developed. The common exposures and the type of contact with the confirmed patient should be thoroughly documented for any contacts that do become infected. Let's work through an example of how contact tracing can be conducted for an emerging respiratory pathogen like COVID-19. If the case is identified in the community, it's important to identify all of the people who had close contact with that individual in the 2 days before up to 14 days after they had symptoms. Once the contacts are identified, it is important to monitor them for 14 days. WHO has recommendations, and the link at the bottom will provide guidance on how contacts can be managed. During the 14-day follow-up of the contacts, if the contact doesn't develop symptoms, then monitoring can stop. If the contacts do develop symptoms, it's important that they are isolated in a medical facility, that they are tested, and that they are treated for COVID-19 depending on the severity of their illness. Once the patient resolves symptoms and they have 2 negative PCR tests 24 hours apart, monitoring and isolation can stop. Now let's work through an example of contact tracing for an emerging respiratory virus like COVID-19 when the case is identified in a healthcare facility. If the case is identified in a healthcare facility, it's important to identify all people who are in contact with that confirmed patient. Contacts can include family members, visitors, or healthcare workers who provided care for the confirmed case. WHO has made recommendations for the management of contacts. For more information, seek guidance in the link provided here. For follow-up, WHO recommends that healthcare worker contacts be tested for COVID-19. If they are infected, they should be isolated and cared for depending on the severity of their illness until they have 2 negative tests and their symptoms resolve. For non-healthcare worker contacts, they should be followed and tested if they develop symptoms. If infected, they should be isolated in a healthcare facility and cared for depending on the severity of their illness, and can be released when their symptoms resolve and they have 2 negative tests 24 hours apart. There are many types of outbreak investigations that could be done if you have a cluster or a group of cases, or if you have a larger outbreak of an emerging respiratory pathogen, such as the novel coronavirus. The first thing that's really important to do before you conduct an outbreak investigation is to assemble a multidisciplinary team. And it's important that you have different disciplines on that team so that when you conduct that investigation, you have the right people that could be part of that investigation. These include epidemiologists, clinicians who could provide clinical assessment, laboratorians or virologists who could do biological sample collection and advise on the right types of specimens that can be collected, infection prevention and control specialists, and importantly, risk communication and community engagement specialists. If an outbreak occurs in an area where the exposure of interest happens to be an animal, it's essential that you have animal specialists included in the team. Before deploying, the team should gather as much background information on the outbreak, on the cluster of cases that they can, and assemble the necessary materials and supplies, such as personal protective equipment, specimen collection, and transport materials before the investigation begins, and inform relevant local public health and animal health authorities. There are many public health objectives in conducting investigations. These include identify other cases and quickly detect any human-to-human transmission, to prevent further cases through the identification of potential human, animal, or environmental sources of infection and exposures, risk factors for infection, and the implementation of appropriate prevention and control measures, and also to reduce onward transmissibility and reduce morbidity and mortality through rapid identification, isolation, treatment, and clinical management of cases and the follow-up of contacts. In terms of the investigation objectives and the knowledge objectives, it's important to determine the size and the geographic area for which this virus is transmitting, to determine key epidemiologic, clinical, and virological characteristics for cases, including their clinical presentation, the natural history of disease, the mode or modes of transmission and disease diagnosis, the incubation period, the period of transmissibility, and best practices for treatment. And very importantly, to determine if there's human-to-human transmission of the virus and if that virus has changed. There are different locations where you can conduct an outbreak investigation. The first one we will describe is an outbreak investigation in a healthcare facility, and this would take place in a healthcare facility where a patient visited or was treated. The objective of this investigation in a healthcare setting would be to identify other cases who may have been in contact with the confirmed case or their biological specimens, including other patients, healthcare workers, and visitors. And what we would need to do is to identify how any secondary cases were infected. That is, what were the exposures that resulted in infection? And quickly be able to recommend measures to stop human-to-human transmission. Other important investigations for zoonotic pathogens, such as pathogens that move from animals to human, are animal health and environmental investigations. So investigators in public health and animal health need to work together in a One Health approach with the following objectives: to identify the source of infection from the animals, to measure the extent of infection in people exposed to those animals, especially among live animal workers, and to develop measures to prevent further human infections. It's important that field visits are conducted so that you better understand how animals and humans come in contact with another, and to look at potential human-to-human onward spread. It's important to do field visits at the patient's home and their surroundings to determine if there are any live animals there, to visit live animal markets or slaughterhouses and to see how people come in contact with those animals, and any other place the patient visited in the 14 days prior to symptom onset and where those animals were present. It's also important to conduct enhanced surveillance. General surveillance in the area under investigation, meaning the area where you've identified cases, should be enhanced or increased for at least 1 month, focusing on setting up lab testing in local healthcare facilities, if feasible, and organizing the rapid transfer of specimens to laboratories that can conduct testing, informing local clinicians in the area of the case definition and the need for vigilance to identify further cases, to conduct surveillance for severe acute respiratory illnesses, or SARI, in healthcare facilities in the community, and increase testing of those patients with severe acute respiratory illness at local healthcare facilities. If resources allow, testing for people with milder illness, such as those that have influenza-like illness. Descriptive analyses of cases, so that the data that you collect from these cases should be performed looking at time, person, and place. And what we mean by this is the place, is what is the geographic location of where these cases have been identified. Create maps looking at where individuals either reside or where those individuals have been. The time, what are the dates of symptom onset of the cases that have been identified? Graphing this or put this in tables so that you can better describe the progression of cases that have been identified over time and create an epidemic curve. Person, what are the relationships and the demographic characteristics between the patients that are identified? Using this data, you can calculate key epidemiologic information such as estimating the incubation period, describing transmission patterns, looking at attack rates by age, looking at if there are certain exposures or occupations that are important for transmission, and looking at clinical data. So clinical data will help you better describe the spectrum of illness, so how many of the individuals have mild disease versus severe disease, potentially looking at the proportion of individuals that have pneumonia, and especially understanding which proportion of the cases that have been identified have died. What do you do with all of these analyses? Data is critical for analysis and interpretation. Collecting the information is not enough. You need to do analyses and look at what those results are telling you in terms of the risk of that outbreak and further spread. This information is also important for designing and implementing mitigation measures to prevent either further zoonotic transmission and preventing further human-to-human transmission. It's important that the results of these outbreak investigations are shared with others so that others facing similar outbreaks can learn from your experiences.